Today we will discuss about the dengue-like illness or dengue-like diseases. So there are many viruses which causes diseases which resembles clinically like dengue fever. And dengue and dengue-like illness, the clinical features are almost same and difficult to differentiate these diseases only on the basis of clinical signs and symptoms. So for due to resemblance with dengue, we require laboratory confirmation of dengue to rule out these other illnesses which also presents like dengue, especially uh, dengue fever, not the complicated dengue or dengue hemorrhagic disease. So under this group of illnesses, there are three main illnesses which resembles like dengue, and they have similarity in between them on the clinical basis. These diseases are most common and well known in our country is chikungunya. It is caused by a virus, chikungunya virus, which is a member of toga virus family. Another important thing is all these three viruses are arbovirus, which means these are spread through the uh, arthropods, or most commonly these are spread by the mosquito bite. And dengue is also an uh, arbovirus viral illness which is also spread by the mosquito bite. So another illness in this group is West Nile fever. This is caused by West Nile virus, a member of flavivirus family. And the last one is Onyong Nyong virus or Onyong Nyong disease, which is caused by a virus which falls under the toga virus family, just like chikungunya. So first we will discuss about the chikungunya. Chikungunya fever, as I already told, is an arboviral disease. This vector for this fever is Aedes aegypti or Aedes albopictus mosquito. These mosquito usually active in daytime, and the breeding ground for these uh, mosquitoes is fresh water, which is usually found in stored water which we have in our households. So chikungunya is very common in India. Now next we will discuss about the clinical feature of chikungunya. Chikungunya is usually mild illness, and it is caused by it manifests itself in the form of fever. Fever usually lasts for 5 days to 1 week, and important clinical feature is symmetric bilateral polyarthralgia. Patient complained of severe pain in limbs and pain in joints. This pain usually subside after 1 to 2 week, but it can also last in many patient almost for a year or 2 years, and mostly patient complaints of joint pain even after 1 or 2 years of the contracting the illness. Another important clinical symptom is myalgia, severe muscular pain. This is also common for dengue, and patient can have conjunctivitis and headaches. So these all, along with these symptoms and signs, patient can also have petechial rashes, which are also common in dengue. So clinical features are resemble as dengue. Now how will we how will we suspect a patient with chikungunya? So there is there are criteria, clinical criteria, epidemiological criteria, and laboratory criteria. So if patient is having fever and severe arthralgia or arthritis, patient can have any of these, like dengue or alpha viral infection. These toga viruses are alpha virus, arthritic disease, or endemic malaria. Second is epidemiologic criteria. If any patient who reside or visited epidemic area within 15 days before the onset of symptom, we classify this as probable case of chikungunya. So for this, patient has to visit epidemic area or endemic area. Now another is laboratory criteria. After acute phase, we can either isolate virus or we can detect presence of viral RNA by using RT-PCR, and we can also have blood test for IgM antibodies and 4 times increase in IgG titer. So if any of these is present, then this will label it as confirmed case of chikungunya. So how will we manage chikungunya? Chikungunya is a mild illness, or and it is mostly self-limiting. So we have to give symptomatic management in the form of paracetamol to to decrease fever and also for the pain, and no other drug is usually used in case of chikungunya. Now we will move on to the other virus, which is West Nile fever. So this West Nile fever has also been identified in India, and we usually do not see most of the cases of West Nile fever because we do not have laboratory confirmation of this disease, and we usually do not had access to labs which are doing RT-PCR test for the West Nile fever or any other serological testing for the West Nile fever. So this diagnosis for this disease is usually missed. And another important thing is that it is also spread by the Culex mosquito, and West Nile fever is mostly found in severe form in the adults. So this is not usually a severe pediatric illness. Now another important thing is that unlike the chikungunya, which is benign illness, West Nile fever can be proven fatal, as it can also cause encephalitis, and there is high rate of mortality in case of West Nile fever. And for the management of this illness, there is no specific antiviral or specific medicine available for West Nile fever. The usual management is supportive. We have to provide cardiorespiratory support, and we have to give anti-epileptics, and we have to give antipyretics for the patient affected with this illness. Now another illness is Ongyong fever. Now this Ongyong is also an African word, and the meaning of this, the translation of this word is weakening of the joints. So the chikungunya, it is also an African word, and chikungunya, meaning of chikungunya is one who bends, because in chikungunya patient have arthralgia so severe that they assume a bending posture, or so in Africa where it usually started, people give it name chikungunya, and Ongyong, which also started in Africa, people give it local name, and which translate as pain in the joints. So the clinical features of this disease are also like chikungunya, and it is also usually mild illness or benign illness which subside it's on its own, and it is spread by the anopheles mosquito. So all these three illnesses are spread by the mosquito, but chikungunya is from Aedes, West Nile is from Culex, and Ong is by the Anopheles mosquitoes. In this Ong fever, management is also supportive, and this is usually benign self-limiting disease. So this sums up our lecture on dengue like illness. Thank you.